Number one is how we interpret disability. We are all focused on physical impairment, hearing impairment, and the blind. So when you come to intellectual impairment, people are having a question mark. How will I deal with this?
The Fabs is an organization that began 1 year ago, began as a school-based project, but currently we are running as an organization that is aimed at fostering empowerment and inclusivity for children with intellectual disability, purposely to reduce or end sexual gender-based violence among children with intellectual disability. Initially, the Fabs began as an acronym for the team members that began the project when it was a school-based project, where F was for Phoebe, one of the members in the group. A was for Adele, another member in the group. You'll get to know them. Then B was Brian. There are two Brians in the group, so we just took one. And S was for a person known as Stephen. They were in the group, but they later on left the group. But because of now we realize that the Fabs exist beyond the people who founded the project, the people who founded the organization. It is an organization that will run beyond me, who is the CEO. It will run many years beyond the original minds and people that were in the project. So we decided now to, because it's a name that has already been established, we decided now to change the perspective of the name. We no longer consider it as the acronym for the team members. It's now a short form for A Fabulous Life, which is a dream that we have for every intellectually impaired child.
We were in the field. That was when we were starting up. We did a research, and when we were doing that research, we met one child, and this child is called, and he had repeatedly been taken advantage of by the uncle. So when the uncle used to come home, because sometimes the parents, they have to double up as the caregivers and the providers. And there's a gap where, do I go to work and leave my child alone, locked up in the house, or do I leave them with someone else? And so he used to be left with the uncle, and the uncle used to take advantage of me. And so in a room where they're all together with the parents and the uncle, she used to be so uneasy that they used to tell the auntie, mchukue huyo mpeleke huko nyuma, analeta shida. And they never used to know that this behavior of being unruly is trying to communicate that this uncle mkiniacha na yeye, there's something that takes place. And so she got pregnant. Unfortunately, she passed away while trying to give birth. And there are many more stories that we found out. And so there's a challenge of communication. The children are trying to express themselves in the best way that they know, and the parents do not pick this as a form of communication. They think that child is intellectually disabled.
In Kenya, children with intellectual disability face a lot of misconception. First of all, these children, for a long time, they have been looked at as you find that they blame their parents for bringing forth such children, because maybe they say these parents, they did something during the pregnancy, or they did something wrong, so that they got such children, which is not okay. It becomes very negative to the parents, and they become stigmatized. They become locked into a cage whereby they can't express themselves in public with their children. They can't move freely with their children because of such negative view by the society. And also the second misconception is society, especially in Kenya, people see like children with the intellectual disability as as a result of witchcraft. Parents may say that I think your child was bewitched, or maybe someone looked at your child in a bad way. That's why they are the way they are. But I think it's due to lack of information. Most of the parents and also society haven't been educated on intellectual disability, and therefore they lack information on this topic, and therefore where society doesn't get to understand a certain phenomena, they result to things such as blaming witchcraft or blaming, let's say, tradition.
It is crucial to promote inclusivity for children who have intellectual impairment, because according to UNFPA, we did a research and we found that young persons with intellectual disability are 4 times more likely to experience sexual abuse. And so we find that these children are in a vulnerable state, and it is a study that has been conducted, and research supports that what we are trying to advocate for as an organization is something that exists. And girls are even at a worse place. And we find that we also decided to carry a research as a team, and the research done by UNFPA was what is on the ground. These children are really being taken advantage of sexually. Their parents are not in the know, because the children are not able to communicate efficiently with their parents. They're not able to communicate efficiently with people around them. And so you find that only when they're pregnant is when the parent notices someone took advantage of this child. And so as an organization, we notice the gap, and what we are trying to do is to ensure that these children are able to be remembered, they're able to be taken care of, their rights are not trespassed by people who can just see an opportunity and take it. So we are trying to create an environment where these children are able to be included, just like any other person in the society. They're able to lead a normal life, and they're able to overcome this challenge that they are currently facing of sexual abuse repeatedly. Only when some of them get sick, only when some of them get pregnant is when it is found out.
Educators and caregivers can easily adapt to the new or to the current existing sexual rights and health education for children with intellectual disability. One, by ensuring that they take into consideration the specificity of the children, that is ensuring that they consider each child's learning needs, their grasping ability, their capabilities in terms of how fast can they learn, what method best works for a particular child, because there are different needs to each child. There are children that are vulnerable, or they're in their profound stage. There are some that are in their mild stage. So depending on the needs of the child, then the educator must be able to understand the specific needs of that child, so that they can tailor the education or the method to that particular child. Another way that can also help is by ensuring that the knowledge is disseminated to the children in a simpler language, and also broken down into smaller bits. If you can understand this when you take into consideration even a normal class for normal children, because of the difference in their needs. Then if you want to make the learning smooth for everyone, then you need to break down the information into smaller bits, and those bits must be communicated in a simpler language. The other method is caregivers and teachers can also take advantage of songs, audiovisual methods, pictures, songs, and also games, which they disseminate information in forms of games, in form of short videos, activities that will engage their different sensory organs, so that because of their ability to engage different senses and different organs of the body, this has shown to improve the understanding of the children in terms of disseminating the information on SRHR.
We have to have the self-confidence in these children. Once we see them as one of our peers, one of like just any other child, it will ease interaction with them. And then you'll create a good rapport with them and understand them better. Another method is to use art. When you use art, you have to find a way to get through them and understand while communicating through them. When you speak to them, when you come just with a very long PDF, you come and then just teach to them like that, they won't get anything. So when you come with a method and your attitude, and then you have self-love for them, the communication will be positive, and also they will have that trust in you.
There's a challenge of communication. The children are trying to express themselves in the best way that they know, and the parents do not pick this as a form of communication. They think that child is intellectually disabled. That's how they behave. Mpeleke uko nje and take them outside. In direct translation, maybe they need to sleep, they need some food, and so we are trying to ensure that our module can bridge that gap of communication, and the parents can be able to pick that my child is behaving like this, maybe it's not normal. My child never does this, it's not normal. And another challenge is access to the resources. You find that people are really advocating for the rights of so many people, but they forget that there are children who are intellectually disabled. When pads are being distributed, they don't remember that there's a child somewhere who is intellectually impaired. And so I think it's important that as we work together, we work to ensure that these children are included in the community, they are included in conversations, and they are included in these campaigns. When you're trying to reach to other girls, remember that there are some girls who are intellectually disabled, and not only girls, even boys. Some boys are being taken advantage of as well, and our main agenda as the Fabs is to ensure that both all these genders are included in terms of sexual reproductive health rights.
Us as the Fabs, we have a running program whereby we are training parents so that these parents can be equipped on how they can be able to communicate effectively with their children, so as to prevent these instances of sexual abuse. So these sessions for parents, we call them wezesha, whereby as the Swahili word wezesha means, we are enabling these parents to be able to, let's say, to be part of this journey, whereby they can help us in ensuring that these children are safely integrated into the society and are able to enjoy life fully. Another initiative is whereby we are doing trainings for volunteers, whereby these volunteers are very crucial and important in the work that we do, because you find that during these trainings, these children require a one-on-one training, which let's say requires a person who's well trained, who can understand these children and can be able to work with them effectively.
The long-term benefits, both individually and socially. First, I'll start with socially. It enhances social engagement, such that whereby the Fabs, we have a parent engagement. So after engaging the parents, it helps them accept their children the way they are. Yeah. Also, it reduces vulnerability to these kids, such that they know how to open up, such if a case happened of sexual abuse. And also, it improves health outcomes, such that it reduces STIs, so that if these students open up, such that I was molested by someone close to me, it reduces.
As parents, don't stay there at home with your child. Get to learn how you can communicate with a child, because the way you communicate with an impaired child, intellectually impaired child, is not the same way you will communicate with a normal child.
We should not, children with intellectual disability, they have an equal opportunity to education. So parents out there, if you have a child with intellectual disability, we should just accept them the way they are, and also we should not abuse them sexually.
The Fabs Kenya, fostering awareness.